Imagine waking up one day and forgetting where you are or not recognizing your own child. This isn't a scene from a movie. It's a harsh reality for millions dealing with dementia. On today's episode, we're breaking down this mysterious condition in simple terms so you can recognize it, understand it, and support those going through it. Hey everyone, welcome back to DocDecoded, your trusted space to decode complex health topics into bite-sized, clear information. If you're new here, hit that subscribe button and turn on notifications so you never miss a video that could change your life or someone else's. Dementia isn't just getting old or being forgetful, it's a syndrome, a group of symptoms that affect memory, thinking, behavior, and the ability to perform everyday activities. And its progressive means it gets worsen over time. Data says episodic memory, ability to recall events specific to time and place, and other cognitive memory is lost in 10% of people more than 70 years and 20 to 40% of individuals with age more than 85. Neuropsychiatric and social deficit also raise in many dementia syndromes, manifesting as depression, loss of interest or apathy, anxiety, sleep disturbances, wrong perception and assumptions, which are called as hallucinations and delusion in medical terms. Thus, dementia, more than just forgetfulness, it affects emotions, sleep, perception, and even social behavior. It's a storm inside the mind. Did you think dementia only meant memory loss? Let us know what you thought dementia was before watching this video. There's no one kind of dementia. The most common ones are Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia. Each affects different parts of the brain, but they all steal independence and clarity. Are you keen to explore all these? Let me know in the comment section. Accordingly, we'll come up with dedicated video. Alzheimer's disease is the most common type. Each type of dementia affects the brain differently, but the result is similar: an increase in difficulty in navigating life. These are long-term conditions, whereas there are certain conditions with short-term memory loss because of certain deficiency or toxicity. Hey, 1 second. Are you thinking of yourself? Have you ever searched for your watch or glasses while wearing them? Don't worry, you're just multitasking badly, not losing your memory. But how can you tell if it's just normal aging or something more? Here are early signs of dementia you can recognize in someone you know. Memory loss, especially forgetting recent events. Confusion with time or place. Struggling with words or language. Mood changes, such as depression or anxiety, difficulty with familiar tasks like managing money or cooking, repeating questions, or misplacing things in odd places. Comment below if someone in your family has shown any of these signs, or if you've experienced a few yourself. Sharing might help someone else feel seen. These are the most common you can observe, but not the only ones. But why the memory loss even happen? Let's know. Dementia happens when brain cells are damaged and they can't communicate with each other properly. In Alzheimer's disease, the most common cause of dementia, there's buildup of abnormal proteins in the brain. Strokes or reduced blood flow to the brain. Head injuries, infections like HIV or syphilis in rare cases. Vitamin deficiencies like B12. The risk factors you should know. Age over 65. Family history of dementia. High blood pressure. Diabetes. Smoking. Untreated and neglected vascular injury, as in previous episodes of stroke, heart diseases. Obesity and lack of physical activity. Social isolation and chronic stress. Can dementia be diagnosed early? Yes. And it's so important to catch it early by observing the early symptoms as we have discussed. Initial clinical analysis supported by a few investigations. CT scan or MRI brain, blood tests is used for diagnosis. An elderly person with a slowly progressive memory loss over years is likely to suffer from Alzheimer's disease. Apart from memory loss, Other early symptoms include anxiety or depression, difficulty in managing money, driving, shopping, following instructions, finding words, etc. In frontotemporal dementia, a related condition, memory loss is not typically a presenting feature, but personality changes, loss of social inhibition, weight gain, or compulsive eating dominates. A history of stroke with irregular stepwise progression suggests vascular dementia. It is commonly seen in high blood pressure, heart diseases, vein or arterial disease of hands and legs, smoking, diabetes. Memory and cognitive tests can help early diagnosis and plan for care, slow progression, and improve quality of life. Is there any cure for this? Right now, there's no cure for most types of dementia, including Alzheimer's, but medications can reduce the symptoms and slow down the progression. The major goals of dementia management are to detect and treat any reversible causes and provide comfort and support to the patient and caregivers. Treatment of underlying causes include thyroid replacement therapy for low thyroid hormone, vitamin for deficiency of thiamine or vitamin B12, antimicrobials for any probable infections, radio or chemotherapy for brain tumors. There are therapies to improve communication and memory. Supportive care, like creating routines, reminders, and home safety setups, should be adopted. The most powerful tools? Patience, empathy, and a strong support system. Caring for someone with dementia isn't easy, but understanding them makes a world of difference. Know a caregiver or family living with dementia. Share this video. It might be the support they've been searching for. Can we prevent dementia? Comment prevention if you're ready to take charge of your brain health today. The single strongest risk factor for dementia is increasing age. The prevalence of disciplined memory loss increases with each decade over 50. You can't control your age or family history, but here's what we can do to protect our brain. The brain smart habits are: stay mentally active, read, learn new skills, play puzzles, exercise regularly. It boosts brain health by reducing stress and hence psychological symptoms to appear. Eat well, like the Mediterranean diet. Sleep enough. Poor sleep is linked to memory problems. Stay connected. Social isolation increases the risk. Manage chronic diseases like diabetes, cholesterol, and blood pressure. What brain-boosting activity do you enjoy? Sudoku, yoga, hobby? Drop it in the comment below. Dementia is an inevitable consequence of normal human aging, remains controversial, although prevalence increases with every decade of life. Prevention is not guaranteed, but these steps make your brain more resilient. Dementia can be scary, but knowledge is power. Whether it's a parent, a partner, or even yourself, it helps to recognize the signs early, get support, and plan care with compassion. Let's remember, behind every confused face is a lifetime of memories. What they need most is not correction, but connection. If this video helped you understand dementia a little better, give it a like, share it with someone who might need it, and don't forget to subscribe to DocDecoded for more real talk on real health. Got questions or a story to share? Drop them in the comments below. We're here to learn and support each other. Let's build a community of care.